Hello everyone. Today we'll see a very high yield topic that is about the ECG abnormalities. Now in our channel we have already talked about the ECG physiology. If you haven't watched that video yet, I recommend you to watch that before watching this video because many concepts in this are just related to that video. So watching that video would give you a better understanding of this video. Now in this video we will mainly see about all the ECG abnormalities. First I will give you a chart through which you can group certain ECG problems. Then we'll see each of the problems separately and I'll tell you about the history by which the patient would present and the ECG findings that can be found in that abnormality, and then I will also tell you the treatment for that abnormality, because usually in the exams there is a case question given and the ECG strip is shown to you, then the treatment part is being asked as a question. So we will also learn in that way so that it will be easy for us to approach the questions. And then I'll also tell you about some classic ECG findings which can be found as a spotter, and then we will see how to draw a diagnosis from the ECG paper. Then finally we'll practice some ECG, and I also have a small quiz for you about ECG and you can give the answers. So let's see about this topic. Now first I have grouped the ECG abnormalities into two parts, part 1 and part 2. In the part 1 we would be seeing about bradyarrhythmias, that is the SA node disorders and the AV node disorders. The SA node disorders are mainly sinus pass and the SA nodal block. The AV nodal disorders are the heart blocks, that is first degree, second degree and the third degree heart blocks. Then we will see about the tachyarrhythmias, that is supraventricular and ventricular. Supraventricular basically means that is atrial, because above the ventricles is the atrium. So in supraventricular we will see about the atrial fibrillation, atrial flutter, the MAT, PSVT and AVNRT. In ventricular abnormalities we will see about the ventricular tachycardia and ventricular fibrillation. Then in the part 1 we will also see about the myocardial infarction findings, about the NSTEMI and the STEMI. So for all these I have given the classical case presentation, the ECG findings and the treatment. And then in the part 2 of ECG abnormalities we will see about the premature complexes, that is premature atrial complex and premature ventricular complex. Then we will also see the bundle branch blocks, the right and the left bundle branch block. Then we will also see other miscellaneous topics like pericarditis, WPW syndrome, ARVD, Brugada syndrome, pulmonary embolism and the electrical alternance and the electrolyte abnormalities like the hyperkalemia, hypokalemia and all those things. So we will cover everything that is usually asked in the exams, and most of the questions you can solve by just watching this video. So continue watching.